Welcome to Beyond the Bowels, a mini podcast series from the Care Management Coalition of Western New York. We're here to break the silence and open the dialogue about colorectal cancer, because early detection starts with open discussion. In each deep dive, we'll talk about the realities of colorectal cancer. Whether you're a patient, a loved one, or just looking to learn more, you're in the right place. Let's get informed, let's get empowered, and most importantly, let's talk. This is Beyond the Bowels.
Keeping up with health advice can feel, well, overwhelming sometimes, can it?
It really can.
That's exactly why today we're doing a focus dive. We want to talk about something really important, especially if you're between, say, 45 and 75. We're talking about colorectal cancer.
Exactly. And
Right.
our goal here is just to pull out the really crucial info on what this actually is based on the sources we looked at. Keep it clear.
Okay, perfect. So let's jump right in. What exactly is colorectal cancer?
Well, basically, it's a cancer that starts in your large intestine, either in the main part, which is the colon,
Right.
or the very last section, the rectum. The colon's job is, processing food, absorbing water, moving waste along.
Okay.
So when we say colorectal, it's really an umbrella term. It covers cancer in either the colon or the rectum.
Got it. So same neighborhood, essentially. And I heard there's some good news related to screening.
Yes, that's a key point. The screening methods we have work for both locations. We're talking things like stool tests you can do at home. Some newer blood tests are becoming available. And of course, visual exams like a colonoscopy. That's where a doctor actually looks inside with a tiny camera.
And finding it early.
Yeah.
Why is that such a focus?
Because it makes a huge difference. The sources are really clear on this. When colorectal cancer is caught in those early stages, it's much, much more treatable.
More treatable.
The chances of success are significantly higher. It can genuinely be life-saving.
Okay, that's powerful. So we know where it starts.
Yeah.
But, what's actually happening inside the body on a cellular level?
Right. So normally our body's cells grow and divide in a very controlled way, replacing old cells.
Sure.
Cancer starts when this control breaks down. Cells begin to grow and multiply. Abnormally, they just keep dividing even when the body doesn't need new cells.
And that leads to?
That excess growth forms a mass, or what we call a tumor.
Okay, tumors. But I know not all tumors are cancer.
Exactly right. You can have benign tumors. These don't spread. They aren't cancerous, though they might cause issues depending on size and location. Then you have malignant tumors. That's cancer. Malignant means the cells can invade nearby tissues and potentially spread to other parts of the body.
Okay, malignant is the key word there. Now, you mentioned this is particularly relevant for folks 35 to 75. What's the most common type they should know about?
Yeah, the vast, vast majority of colorectal cancers are a type called adenocarcinoma.
Adenocarcinoma.
Right. And these typically start in the cells that line the inside of the colon or rectum. Often, they actually develop from something called a polyp.
Polyps. I've definitely heard that term, like little growths.
Exactly. They're growths on the inner wall of the colon. Many are harmless, benign. But one specific type, called an adenoma, that's the type of polyp that has the potential to change into cancer over time. It can be a slow process, sometimes years.
And these adenomas, are they common?
They become more common as people get older, particularly over 50, which leads us directly to the screening recommendations.
Ah, okay, so that's the logic. Because these potentially precancerous adenomas are more likely as we age, that's why screening starts around 45 for most people.
Precisely. For someone at average risk, 45 is now the recommended age to begin screening, because that's when the risk starts to noticeably increase for the general population.
Average risk. But what if someone isn't average risk? Like if it runs in the family?
Great question. Family history is really important here. If you have a close relative, like a parent, sibling, or child who's had polyps or colorectal cancer, your risk is higher. And in those cases, screening recommendations often change.
How so? Earlier?
Yes, usually earlier. Often the guidance is to start screening at age 40, or maybe even 10 years before the age your relative was diagnosed, whichever comes first.
Wow, okay. That really highlights why knowing your family's health history is so crucial.
Absolutely. It's a vital piece of information for your doctor. Discussing your family history and any digestive symptoms you might be having helps determine the best time for you personally to start screening.
Makes sense. We also saw a mention of something called FAP, familial adenomatous polyposis.
Ah, yes. FAP is much rarer. It's an inherited condition, meaning it runs in families genetically.
Okay.
And it causes someone to develop a huge number of polyps in their colon and rectum, sometimes hundreds, even thousands, often starting at a young age.
Thousands. Wow.
Yeah. And with classic FAP, if it's not treated, usually by removing the colon, the risk of developing colorectal cancer is extremely high, often before age 45. There's also a milder version with fewer polyps, but still a high risk.
Okay. Good to know, though rare. So let's try and summarize the key things for everyone listening.
Sure.
Colorectal cancer starts in the colon or rectum. It often comes from those polyps we talked about, specifically adenomas.
Right. And screening is incredibly important for catching it early. For most people, start thinking about it at age 45.
But definitely talk to your doctor sooner if you have that family history.
Absolutely. And remember, early detection, whether it's through stool tests, blood tests, or visual screening like colonoscopy, really boosts the odds of successful treatment. It saves lives.
Definitely. So here's maybe a final thought to leave you with. Take a moment, really think about your family's health history regarding this. Have there been polyps? Has anyone had colon or rectal cancer? And armed with that knowledge, or even just your questions, talk to your doctor. Have that conversation about when screening is right for you. Being proactive, asking the questions. That knowledge is really empowering.
That's it for today's episode of Beyond the Bowels, brought to you by the Care Management Coalition of Western New York. Remember, colorectal cancer is preventable, treatable, and beatable, especially when caught early. If today's conversation sparked questions, share it with someone you care about, because when we talk about it, we take the first step towards saving lives. For resources, support, and more episodes, call us at 716-800-2120 or visit us online and follow Beyond the Bowels posted on our social media channels. Until next time, stay informed, stay proactive, and keep the conversation going, because early detection starts with open discussion.